Thank you for checking out We Heart Therapy, whether you're watching on YouTube or wherever your podcasts are found. Make sure you check out my book, Using Relentless Empathy in the Therapeutic Relationship, Connecting with Challenging and Difficult Clients, available on Amazon. It was endorsed by Dr. Sue Johnson, pioneer of wonderful EFT, which is the model of counseling I use. So make sure that you check it out. If you're interested in coming to some fabulous CE retreats, I host some. You can find it on wehearttherapy.com. Retreats for therapists that are fun. I have Therapist Summer Camp where we engage in cultural experiences and fun and earn our CEs at the same time. If you're a therapist, you're interested in working with me for EFT supervision, getting some consultations, or maybe you're just a regular couple off the street and you might be interested in working with me as your therapist. I offer couples intensives and individual therapy. You can find me on my websites, drbelle.com or lasvegasmarriagecounseling.com. Would love to have you here in Las Vegas and we can do some really good work together or have some fun doing an EFT training or earning some CEs wherever that might be. Make sure you check it out. And if you haven't hit subscribe for my podcast, make sure you do so now because more episodes are on the way. Welcome back, everyone. You're watching We Heart Therapy, the special series EFT Talk. I'm your host, Dr. Belle, licensed marriage and family therapist and certified EFT supervisor and therapist here in fabulous Las Vegas, Nevada. And I am super excited to welcome back to our show. We have Dr. Andrea Pagani from Rome in Italy, together with EFT trainer Julia Altera. They are co-founders of EFT Italia. And Andrea has a center in Rome where he also teaches at the University of Rome in their School of Psychotherapy. And he is an amazing trainer, and he is working on some groundbreaking work around using EFT in group therapy settings. And that is what we are going to be covering today for our topic. So we just want to give a big buongiorno to our Italian community as well. And welcome Andrea with us today. Thank you, Andrea, for being with us again.
Thank you to you, Annabelle. It's a really great pleasure for me to be here in a We Are Therapy and speak about this work that I hope it will be interesting to our world of EFT and our world of psychotherapy and psychology.
Perfect. So, Andrea, can you start us off by maybe sharing a basic overview of EFT and why and how EFT would be good for group therapy?
Yes, Annabelle, absolutely. You know, EFT is a model based on attachment theory that helps people access, regulate, and transform their deep emotional experience. When applied to the group context, something powerful happens. The group itself becomes a living emotional field because our very nature as human being finds in the space of the group, and particularly in the clinical group setting, and suitable environment to co-regulate with respect to our emotional selves. And through the presence of the other, we have the opportunity to share, to be seen and heard, central aspects of a good attachment experience. And in a group, each client brings our nervous system, attachment history, and relational patterns, and their works in a shared place. And this is fantastic because it's a perfect field for EFT to grow and to touch the point that EFT therapist interest to help their client.
That's perfect. So if I understand you right, Andrea, as you so beautifully said, that when people come together in group therapy, it is a place where they can find sort of connection together to be seen and heard and not alone in some of their experiences. Am I getting that right?
Exactly. Exactly. And we, in this moment of history of the world, we need this. We need to be with the other in a safety way.
Mhm.
We, we need to share our emotion in a safety
Mhm.
field. And this is very important. And I think that the group is a moment for the
Mhm.
truth about how who we are, and for
Mhm.
the truth about how our colleagues that are in the group about clients, clear, are. And this is very important. It's very, very clean experience for the
Mhm.
clients.
Mm. So being able to share their emotion in a group can help them get support, and that's part of how we get connection too. And I imagine help around, what to do with our painful emotions, which is hard to get that help alone.
Exactly, exactly. And if you think about the experiences about trauma,
Mm-hmm.
when you can speak about, when you are a client and you can speak about that with the other, and you can share something that before never you share with the other, this is a powerful experience. This is the new. The group gives the opportunity to have new experiences,
Mm-hmm.
to go across the trauma, for example, the sadness, for example, the joy, why not, for example,
Mm-hmm.
the hope, for example. So with the other, and this is very important, you are not alone in the room with your therapist, but you are with the other, normal other. This is a really great, powerful for
Mm-hmm.
our experience.
Mm. Yeah, I like what you said right there to sort of punctuate, to not just be in a room with a therapist, but to be with normal others, right? Like our peers or, people that are like us in the outside world. Not that therapists aren't normal people, but, you know, it's easy to think, oh, I'm with professional. Okay, yes, they know what to do, but to also get support of non-therapists, and to have connection, and as you said, to be seen and heard, and to not be alone in our emotions, even as you said, related to trauma, can be very transformative.
Absolutely, absolutely. Is a fantastic opportunity, I think, for the human being. And I work in a group from 25 years.
Mm,
So I have a really great experience about this setting. And when I started to work, I started with the Gestalt therapy. And I
mhm,
was a Gestalt therapy in group for many, many, many years.
mhm,
But at one point, I understand that some Gestalt, like some others model of group therapy, have something that doesn't work, that don't work. And we need safety. We need something that can help the people to make little step about
mhm,
their emotional experience.
mhm,
And sometimes in the group, the therapist or the model ask to the client to go fast, to run inside
mhm,
of the motion. But
mhm,
when Sir Johnson to arrived to present EFIT, for me was a really fantastic opportunity to
mhm,
use EFIT in a group. And when
mhm,
we use EFIT in a group, we can change the point of view.
mhm,
Our group is not a group therapy, that it means that we see the dynamics inside of the participant of the group, but our groups is a possibility to work individual in
mhm,
group. And in
mhm,
the end, I uh, build the process to work
mhm,
individual way with IFIT inside the group. And this
mhm,
changed. What changed? Changed the opportunity to live the experience of the client in a window in the respect of the window of tolerance, in the
mhm,
respect of the safety, and in respect of the clients, of course.
Mm,
And this helped too much. I started to use EFIT in group 4 years ago, and I can say that my way to work changed very much, and
mm,
also the steps that the client have in the group was really, really much strong. And so
mm,
at first, it's always important to say thank you
mm,
to Sue because she given to us a fantastic model that we
mm,
can use in different modalities and
mm.
also in different settings.
So what you said, Andrea, and this is really interesting, is not just applying EFT to group settings, but in particular, you found it helpful in adapting EFIT into groups. And can you share a little bit more about how a therapist would use EFIT, how they would apply it in that group setting?
Yes, sure. When we use EFIT, we use the Tango at the first, use the stage at the stages like a structure. But if I use Tango or stages for a group, is too much complicated, in my opinion. We lost the map, we lost the opportunity to have a clear work. But if you use Tango and the stages for an individual client that work in a group, this changed too much. We work directly like an individual session in EFIT, and when I start with the client to work is a clear an individual session. And so I can go to the movement one of Tango. I reflect what happened in the structure of himself, in the relation with the other. And when I clear this, I go to the movement two of Tango. I go to distilling the emotional experience all in individual way. And at that moment, we can have one enactment that grows in that moment
Mm,
because often the client are stuck in the dialogue with their important person that live around them
mm,
or are
mm,
stuck about one part of self. So I
mm,
can ask to the client to choose another member of the group that can represent
mm,
one people of their life. For example, I don't know, father, mother, friends,
mhm,
partner,
mhm,
sister, brother, what do you want, friend,
mhm,
etc. And I asked to him to share the new thoughts, the
mhm,
new message with the other client. And this is very powerful because we have not we in EFIT we go to imagination of the other in our mind. In
mhm,
the group we have the meeting with the other. We
mhm,
can see the eyes, we can feel the smell, the emotions, the body language of the
mhm,
other. So the message, the emotional message, it's much more strong in that moment.
mhm, mhm,
And also, if you have an experience, if the work bring the client to an experience with the self of the client, he can choose himself or herself, or what do you think that is your client, with a little part of him or etc.
mhm,
And it's very powerful because when you see yourself at 3 years or 4 years after a traumatic experience,
mhm,
that was really, really, really strong.
mhm,
So the other are involved in this moment. The group works in this moment. And after movement three, I go to the movement four. And the movement four of Tango works with the feedback and resonance. The feedback are experiential feedback from the other clients to the clients that work it. And
mhm,
resonance is for the therapist because somebody can share to the therapist, oh, this situation, remember my situation.
Mm,
Now I have a father like the father of,
mhm,
etc.
mhm,
Or when he says, when the other client says this, this bring to me at when I was 13, for example, etc.
mhm,
So the group are involved in the work
mhm,
and work again in a different way, not for the process of the group, but
mhm,
for the elements that are for they themselves.
mhm,
And if something grows in that moment, I have a blackboard that is very powerful instrument because help me to organize the next work with the other client. And I give to them this blackboard and
mhm,
they sign their name on the blackboard and then we'll make the next work in individual in
mhm,
EFIT.
mhm.
This is
That's
the process very fast. I'm sorry. I know
yeah,
that.
no, it's good. It's good. It sounds like, and actually, I'm drawing some connections, some parallels in the way that we do EFT training seems almost kind of similar when we do like role plays in groups or when we do supervision in group and we might work with one person and we're kind of working on their blocks, but they are maybe role play with someone else in the group. And then you process what that experience was like, and everybody around is also part of that process and feeling, oh, that's similar to, I have, like in supervision, I have client like that, or, so it's like working with one, you work with everybody because of that resonance. I love that. And
Exactly.
that seems so cool. So in some ways we are already doing EFT, EFIT in groups when we do EFT trainings or group supervision without even knowing that, you know, and now you're just making it very clear and structured for the group therapy setting. And I think that's really neat. When you mentioned that you would have the client like do an enactment and sort of like what we would call like the empty chair, but you're having another group member kind of be in the chair as like a stand-in. And it can be so powerful. And it is to say it, we see this in therapy all the time. To say how we feel to the therapist is one thing, but then to turn to someone else that you're not paying to resonate with you and say it, it has a much different experience many times. So it's so powerful. And then you have just everyone around
Wow. Exactly.
supporting,
Yeah.
feeling,
Yeah. Yeah.
relating, right?
Yes.
That's
Yes.
that resonance.
Yes. Yes. Exactly. This is very, very important. You say much things very important. Sometimes in the training we make some role play that can that are not fast from this. The difference is that this is a group of normal clients.
See, yeah.
So, when you teach and when you have a group of psychotherapists or
Yes.
psychologists or a counselor, the people
Yeah.
more or less know
Yeah.
how manage their
Yeah.
emotion. And it's different, just a
Mhm.
bit different when the
Mhm.
client, the group are only of clients
Yeah.
and so for do this, we need some rules,
Mhm.
clear rules that
Mhm.
help the client to manage
Mhm.
their emotion. And also it's very important that the people feel safety. So when you
Mhm.
have a group of clients, it's important that in general, nobody know the other outside of the group
Mhm.
because you touch something that can be really, really, really personal
Mhm.
experience. So I live in a big city. Rome is a very big city. So in my groups, I haven't people that know each other. But I know also that in little city, in little country, it's possible that somebody know it, the other
Mhm.
clients. But this is important that we make a moment of assessment before to put one
Mhm.
client inside the group to have a
Mhm.
valuation if the
Mhm.
experience of the clients is good for the other clients that was inside of the group before.
Mm. So it sounds like, Andrea, one of the ways that the therapist creates safety is doing some assessment with the clients before having them join the group to make sure that they can kind of tolerate that group space without sort of disrupting the safety or becoming, would you say, maybe volatile or escalated, or what would you say?
Yes, there are some problems that our clients have that is not good for working group. For example, about psychosis, is important that is not possible to work in some kinds of group. You must value. Assessment is process that help us to understand, and there are many level. It's clear,
Right.
but in general, if you have a psychosis, you can't work in this kind of work group.
Mhm.
Also, if you have some behavior, not dysregulated behavior about sexual behavior, because it's easy that during the work the sexuality start from the participants. So it's important that there are some rules that the clients can keep to don't go outside of this rule, because
Mhm.
we lost the possibility to work in group when the people meet outside each other in a
Mhm.
romantic relationship or
Right.
in sexual relation. We at that moment simple the group doesn't work for that clients,
Right.
because
Right.
they lost the freedom to work in group therapy,
Right.
and it's another thing. So it's
Yeah.
important that we have a process of assessment, and
Mhm.
before to introduce a new client in the group, I did a three individual session with the client to understand if
Mhm.
they have the capacity to be inside of group therapy.
Yeah, that makes sense that if clients formed a relationship outside a group, it would make it hard to work in the group because now they have a new relationship. So it might be harder to be more vulnerable and open. But also, if that relationship goes bad quickly outside of session, then that could get brought into session and just create a domino effect. So it makes a lot of sense. And I like that idea of assessment. Because I also imagine too, if someone is early in their therapy work, even individually, and there's so much dysregulation that even in a group setting, it would like dominate, or the therapist could not help bring them back, and then it could trigger, everyone else, other people might feel unsafe, and it just might take over, and there may not be enough time to try to work with them to bring them back, and then the whole group becomes about them, and then I can just see how it's important to have those rules to help create safety and good assessment so that the group can just be a good process, a safe, like basically a safe haven or secure base in a way to grow and explore themselves around within connection to others and
Yeah,
witnessed by others.
exactly, exactly. And when you have these little steps when you build these little steps with the client, the possibility of growth for a client is really, really strong, because share experience, deep emotional experience, and super deep emotional experience with the other, and speaks with the other, and the and all what you say inside of this group remain in the memory of the other is fantastic. You are not alone. You are not alone for many, many, many years after a group. Also, if you let the group, this is obviously we have stage three. Everybody, who arrives at the end of the street of the therapy, arrives at stage three and say goodbye to the group and receive a goodbye from each or who want
Mhm.
participant of the group, so can bring outside of the group what learn, what emotionally experience changes in her mind. And so my focus it's always like therapists that the client bring outside of the different clinical setting what they learn in the clinical setting. So
Mhm.
this is very, very important for me. Is I
Yeah.
don't want that the people change inside of the group but don't
Mhm.
change outside of the group. For me, it's very
Right.
important that the people change inside and bring that changes outside.
See. So I have a question. So I'm thinking if the group is reaching stage three of the process of EFT, how long is the group going to be? Because I know many therapists that do groups, sort of, it's like for a certain number of weeks or a certain number of meetings. And I know in EFT, we cannot always guarantee that they will get from here to there within a preset amount of time. So how do therapists factor that in?
I think that we must always reflect about the process, where the client are. So I put some markers that let to me understand where the clients are inside of process. It's
Mm,
possible that I have one session. Generally, I have two sessions for months in group. So we see
mm,
2 days for months. So I
mm,
can, if the problems are not too much complicate,
mm,
1 year is great opportunity to change much in their experience. For the other client that haven't relation outside of the
mm,
group is a great opportunity to meet somebody in a real way and meet somebody about emotional way. So it's possible that the group is for 2 or 3 years
mm.
for each of these clients. It depends. Really,
Yeah.
it depends.
Yeah. Depends on,
The
right,
story of every human
right,
being is different.
right,
Somebody has nobody outside of the group, and
right.
the group it's a great resource for them. But
Mhm.
every work, like every work, the
Mhm.
group more or less can't have the time more than three
Right,
years. Okay, but
right.
depend. It's like individual therapy. We can
Mm,
have many changes in
mhm.
3 months, and other clients need 5 years.
Yeah, yeah. I like what you said. It probably depends on what kind of group you're running, like if it's for trauma or like maybe divorce recovery or substance abuse. Like people run groups for all kinds of topics and focus, and depending on what that focus is, something more deep and embedded and um, like entrenched will obviously take longer, just as with regular therapy, than, a group. If you're going to do, if you have limitations that it has to be a 10-week group, then you're probably going to pick a topic that's not trauma, you know.
No,
Yeah.
sorry, Annabelle, when you speak about this, my mind go to an experience that I
Mhm.
had not much time ago when after 2 years and a half of a group, one client for the first time spoken about the abuse that he had at age of 4 years. So after 2 years and a half, but I think that is not unnormal. This is clear because you need a really safe place to share one experience like this that never you spoken about it before. You need
Right.
2 years and a half, 3 years.
Right.
It's okay. And
Right.
it's not important for me. For me, it's important the process
Right.
where the client are, where the clients are, where the client is in that moment. It's the place where we work,
Yeah. So it's
like EFT
very,
therapist.
yeah, yeah. So it sounds like maybe one of the factors would be if the therapist has constraints around a set number of sessions, or if it's kind of open-ended, if it's something that's open-ended and they have the luxury of really letting that process flow and be natural and organic, then they can focus on that and they don't have to worry. Oh no, we only have 10 sessions. We need, so that would be kind of different. And yeah, and I like what you said with deep stuff like traumatic histories and stuff. It may take a couple of years to be able to reveal something so deep and personal with other people. And it is a huge step. It is a huge step. And yeah, yeah, I really like what you said. And I'm thinking too, so with the therapist, what would you say is their role in
Oh,
the group?
yeah, the role of the therapist is very, very important, because the therapist needs to manage the individual client and the group client and the group because is important that manage the reactivity in some moment that can grow in some situations. So the experience is important, and also is important that the brain always work about the individual client and what happens in the group.
Mhm.
And is a double work in
Mhm.
every moment. My brain
Mhm.
works to
Mhm.
see the group and the
Mhm.
individual, and some individual that in some moment go in expression only with the body, for example, about something. So when, for example, I finish the tango with the client, I ask, somebody of you want to share something about what happened during the group, during this work, or where are you? Where are your body? Do you want say something about this to me now? And
Mhm.
it's possible that nobody says something, but my brain is important that works always to understand what happened
Mhm.
between and intrapsychic inside
Yeah.
of the group.
Within ourselves and between ourselves and
Exactly, between.
others.
Sorry, because I don't
Yes.
remember the word
No,
in
it's
English,
perfect. It's
but
perfect. It's perfect. Yeah. So it's still like a process facilitator, but I imagine this is where there's a little bit of overlap with EFFT, where you may be working with one, but you have to be aware and paying attention to the others in the room and the dynamics and how they're affected or responding in the moment. So it can be a lot to track in those moments.
yes, yes. I think that if I can give a suggestion for who wants start with the e-fitting group,
Mhm.
I think that is better start with little group.
Mhm. Yeah.
4 or 5 clients are perfect.
Okay.
So you don't must track what are the relation between the others because we
Right.
remember it's an individual therapy. When I think about the EFFT, it's a little group therapy, and I work in a group therapy because it's important the systemic point of view and the relation between the others. In e-fitting group, it's a part of the work, but it's not the focus of the work. The
Mhm.
focus of the work is always EFIT, the
Mhm.
work of individual. You can sign in your mind that something happened at your left, at your
Mhm.
right, in the mind of that woman, in the mind of that man, but the work it's always about individual. And
Mhm.
when I see something that happened in the mind of the other, I don't reflect immediately what happened, but I signed in my mind. And when will arrive the moment of the other client,
Mhm.
it's important that I remember what happened in the past,
Mhm.
because sometimes to reflect what happened in the
Mhm.
moment, I'm sorry if
Mhm.
it's too much complicated, but yeah, when I want to reflect what happened in the moment of
Right.
new individual
Right.
session, I remember what happened in the past, and I can put some links that help me
Mhm.
to understand better what happened in that client. So this is
Yeah.
the difference. I don't know if it's
It makes
clear.
sense. In EFT, we would say like finish the mission, basically. And that comes out of our success and vulnerability work. And it's we say stay with, on the mission you were working with. You
Exactly.
stay with
Great,
them.
great
Yeah.
link. Thank you, Annabella.
Yeah.
Exactly. The mission. Like
Mhm. Yeah. But you're
Exactly.
making a note, but you're not letting it pull you off the mission in that moment.
Absolutely. Absolutely. Like
Yeah.
say George always the mission,
Yeah.
the mission.
Yes,
Don't forget
yes,
the mission. Great,
yes,
great, George.
yeah.
Thank you,
Because
George.
if that other pulls you off mission, then you can kind of leave that person hanging with like an open wound or an open bleed or on that
Yeah.
limb of vulnerability all alone, and that could be unsafe for them.
Exactly. And I want to add that we really sit with the pain that are in that moment arrive to our client, that work in that moment. Some group therapies work also with the other, but
Mhm.
is very important that when arrive that pain, we stay
Mhm.
with that pain, we sit near that pain, we have that mission, like thank you, George, about this fantastic world, and we work in that direction and stop.
Mhm.
After this tango, we change and another tango with the other
Mhm.
client. It's important that we have that memories about what happened 2 weeks before.
That's beautiful. And Andrea, I have a note that you have maybe a story that is kind of touching about your work in group therapy. Would you be willing to share it with us before we wrap up?
Yeah, really, but I want to share with you one part because really what I see and what I viewed in the last group that I had 2 weeks ago, and I want to share this little part. What I see in my past that many clients had a fantastic moment of reconnection with their emotional reparative experiences, absolutely. But what I want to share with you is the motion of the little step that in every session the clients do. And this small step after moment build a very big changes. At the end of my when I think about what is a strong moment that I want to share with you, really, I want to share with you the power of the little steps. And every time when I see, for example, my client of 2 weeks ago, um, uh, I use a fantasy name for
Mhm.
Sarah. I
Mhm.
remember Sarah that for the first time in her life, she asked something for her, and she put her name in the blackboard to have something for her for the first time after 1 year.
Mhm. Mhm.
That was a
Mhm.
great moment for me. I
Mhm.
was really grateful for her because in that moment I feel that she trusted in the field of
Mhm.
the group,
Mhm.
not only in me like a
Mhm.
therapist, but she trusted in the field of the group. And this really is a great moment for a therapist because feel that something changed in deep experience of Sarah. And
Yeah,
I can
it's
share this.
beautiful. It's like her feeling safe enough now to start to bring herself forward and start to engage in this way, in a new way than before. And
Exactly.
it's like a small step, but really big also.
Exactly, exactly. This is the gift. And also, I want to share that often I start to work in the group that I have many thoughts about my life, like every human being.
Mhm.
But at the end of the group, the work of co-regulation that there are inside the group helps me, like therapist, to be much more relaxed,
Mhm.
happy, because the power of co-regulation that we have in a group in an indirect way, it's
Right.
fantastic. So it's a good for the healthy of the
Yeah.
therapist, I think, a group,
Yeah.
a fitting
Like
group.
in some ways, the therapist doesn't have to work as hard because the group is carrying a little bit of the load, like balancing the load a little bit.
Yeah, and I felt this sometimes in couple therapy.
Mm-hmm.
When you start a session with the couple and you arrived with your brain that is completely off,
Mm-hmm.
but at the end of the session, a nice session with a deep connection, for example, about stage 2, you go off the session much better than than the beginning. This is a
Yeah.
gift of the therapy.
That's beautiful. It's beautiful. So I know we've got to wrap up. And you guys, if you love what you've heard today, we're working on doing a training with Andrea around using this because there's so much more that Andrea could share. And this is just kind of an introduction to how EFT can be used in a group therapy setting, specifically adapting EFIT. And there's so much there, but we just wanted to get something out there for you guys so that if you're already doing groups or you want to do groups, that yes, there is a place for you to use this beautiful model of EFT and attachment in those settings. And Andrea, if folks want to find you, if they want to train with you or work with you, how do they find you?
Yes, you can go to the website of EFT Italia and search something about e-fitting group. There is the topic inside of the website. I share something inside of the website with my intervents in the summit. In the last summit, I share also some slides about that, so you can find some resources free for you if you want if you want know much about this. And you also, if you want to organize one workshop about e-fitting group, you can write to info
Mhm.
at EFT Italia Community with a Y at the end, .com.
Okay. So info at EFTItaliaCommunity.com. And I
Perfect.
will make sure on YouTube, if you're watching this on YouTube, I'll put a link to that, to the email and the website in the description for the video. And if you're listening, just rewind and take a note, hopefully. But Andrea is amazing. And you can also Google Andrea Pagani EFT in Italy, and he will come up. And I highly recommend looking out for his training. Of course, we will make it available on ICEFT when it does become available if you want to attend. And it's going to be fantastic. And like Andrea mentioned, he's been working in groups for 25 years and he's got so much wisdom and really just to help other EFT therapists with something they're probably already doing in their practice with group therapy and how to harness the power of this beautiful model
Oh.
in that setting. So,
And I want to only add the one thing, Annabelle, that the workshop it is recognized by ICF, is an
yes,
official
yes,
workshop. I want to only
yes.
say the add this. Sorry.
Yes, yes. But when there's specific dates, then it will be on the training section of ICEFT for you to know, oh, October or January or whatever. So you can take Andrea's training. It is an official ICEFT recognized training. So EFT/EFIT in groups. So we're so excited for that, Andrea. And thank you for all of your wonderful work and for being here with us today. And we just want to say thank you to our viewers. Hopefully, you'll catch us online or just make sure that you subscribe. Also, if you want to come do some CE trainings with me, I have my local EFT community here in Las Vegas, but also my brand, We Heart Therapy. I'm doing some CE events. You can go to wehearttherapy.com and doing some pretty cool stuff there, therapist summer camp. So make sure that you check it out and come join us. And hit subscribe because more videos are on the way.